Good evening, and thank you for joining us. I'm Alex Flood. More than a month ago, the Thunder Bay District Health Unit announced it was ramping up its wastewater testing for COVID-19, and now the health unit is making those numbers known. TBDHU's dashboard now includes the level of COVID within the city's sewage treatment system. Dr. Janet DeMille says the data can be anywhere from 5 to 7 days behind, adding that the wastewater is sampled 3 times a week. The data shows a larger picture than what is known from COVID tests due to limitations in testing eligibility.
And we're still, I think, sort of understanding what the data actually means. We did see a peak earlier in January that matched when our cases were particularly high. And then it has gone a little bit up and down since that time. Sometimes, the fluctuations have been quite significant.
The testing is only indicative of the levels of COVID-19 within the city of Thunder Bay, as septic systems and regional communities do not use the city's wastewater treatment plant. The Thunder Bay Regional Hospital continues to work through staff being forced to self-isolate because of COVID-19. As of Thursday, around 3% of staff were at home, which is more than 100 employees. This, of course, causes issues for a variety of hospital services, especially as we have seen rising COVID hospitalizations at Thunder Bay Regional throughout the month of February. Rhonda Crocker-Ellicott is the president of the Thunder Bay Regional Health Sciences Center and explains how having that many staff away work affects their operations.
That does complicate the ability for us to ramp up our non-urgent, non-emergent surgeries as well, because we are continuing to ask staff to be redeployed to help support the COVID care unit. So we've been very pleased with the response, but that said, we're going to need our case numbers in terms of our staff off for COVID positivity or self-isolating due to exposure to come down as well.
Crocker-Ellicott went on to praise the staff for their work during this difficult time, and she says more surgeries will happen as more people return to work. Maintaining the number of medical professionals, especially physicians, has been a tough task for communities across the region for many years. As a result of the global pandemic, resources have been strained even further, with some medical facilities experiencing burnout of physicians. To address that, recruiters at the Geraldton District Hospital in Greenstone have shifted and expanded their efforts, which has so far paid off. Adam Riley has the details.
Greenstone has a lot going for it right now as the result of the construction of the new Greenstone mine, which continues to bring workers and new residents to the municipality. With an increased population comes the increased demand on the healthcare system. And while Geraldton's new $21 million expanded emergency department, which opened last year, has been beneficial from a staffing perspective, doctors were running on fumes, which on more than one occasion reached a critical point.
We were faced with a possible closure with our emergency department in July 2021 and December 21.
Greenstone Deputy Mayor Jamie McPherson says normally locums from other areas of the province would come in and relieve pressure, allowing full-time physicians some time off. But COVID-19 has changed the game through new health and safety and isolation protocols.
Well, some of them cannot come up because of the protocols. The amount of time they'd have to isolate, the 14 days before and after. And so that meant the load fell on the existing physicians.
To counter that and prevent burnout, Geraldton District Hospital's physician recruitment team shifted their focus to bring in a nurse practitioner, which, unlike regular registered nurses, can diagnose, order tests, and prescribe treatments. Rochelot says immediately a positive effect was felt in the emergency department, with 93% of patients being taken care of by the nurse practitioner. The success of that introduction was noticed by others and allowed GDH to have an impact beyond the Greenstone area.
Adacoken was actually struggling with the exact same thing we were struggling last summer. They were looking at potentially closing the emergency department. They reached out to us and we actually sent our NP down to Adacoken, and she was able to work in the emergency department, which kept them open.
Currently, GDH is looking to add a second nurse practitioner to their ranks while continuing to entice physicians to move to Greenstone. Rochelot says plans are in the works to create an urgent care clinic in the emergency department to further reduce strain on the system. Adam Riley, TBT News.
Throughout the month of February, Lakehead University has been hosting events in celebration of Black History Month. And on Friday, the university hosted a discussion panel in which students spoke about the BIPOC movement, which stands for Black, Indigenous, and People of Color. The panel featured a number of LU students expressing their opinions on the impact the BIPOC movement has had on their lives. The panel also took a look at the reaction to the movement this year compared to last, and if there was a significant difference. The panelists mentioned that more work needs to be done when it comes to educating the public on the struggles of visible minorities.
People who are already experiencing these systemic barriers shouldn't be the ones that are responsible for educating others on them. So we shouldn't be putting them in a position where it's their responsibility to have to explain to others what they can do to better support them. Because I think that as at the university level or as a community as a whole, people that aren't being affected by these barriers need to realize the privilege that they come from, and they need to be doing the work.
For all of February, residents and students can visit the university's Black History Month celebration website, and visitors can learn about key moments in Black history and register for upcoming events. In other news across the north, the Ontario Health Coalition says the provincial government is looking at allowing independent health facilities to operate as for-profit private hospitals. CTV's Lindsay Alick has the story.
Earlier this month, Ontario's Health Minister Christine Elliott made the following comments.
Making sure that we can let independent health facilities operate, private hospitals.
This is what's concerning a healthcare watchdog group that says this can't happen.
What the minister just announced there is that she's going to allow the private clinics in Ontario, the independent health facilities, almost 90, so over 97% of which, according to the provincial auditor, are for-profit, to operate private hospitals. It's a bombshell.
Mara adds that it would be devastating at any time, but especially right now with staffing shortages.
We're talking about our hospitals that would take the lightest, easy care, profitable patients out of the public healthcare system, leaving the heavier care patients behind with too few staff and fewer resources even to provide for them. And that would be absolutely disastrous.
A spokesperson for the minister's office says this is not accurate. Independent health facilities and private hospitals that perform publicly OHIP-funded procedures already exist in Ontario. Her comments were in reference to the resumption of previously scheduled non-urgent procedures that may have been paused as part of Directive 2.
The privatizations of our healthcare system has been something going on for some time. If you remember, in Sudbury, people that had hip and knee surgery, you would go to the hospital to have your physiotherapy. Now, this is not available to us anymore. You have to go into a private physiotherapy clinic in town. The IHF, independent health facilities, are all, except for one, for profit, and they're all biting at the bits to be allocated more cases.
Mara says it's not just Elliott's comments that have the coalition concerned. She says the privatization of surgeries and diagnostics is also listed in the province's pandemic plan. Coalitions across the province will be holding meetings over the next couple of days to further explore what this could mean for health care in each region. Lindsay Alick, CTV News, Sudbury.
The recent heavy snowfall in Thunder Bay didn't stop locals from enjoying the long weekend outdoors, as hundreds made their way to Marina Park on Sunday afternoon to take part in the city's 4th installment of this year's Winter Fun Days. It's become a popular Sunday tradition as Thunder Bay residents came out in droves to take part in this week's edition of Winter Fun Days. Locals enjoyed a number of outdoor activities, headlined by a variety of impressively handcrafted snow sculptures. Kids also had the chance to make their own snowy creations, and families had fun putting their faces in ice cutouts for some memorable pictures. And just a short walk away, visitors could try their hand at ice fishing, as the thick ice made for some great fish snatching conditions. Louisa Costanzo, the supervisor of cultural development and events with the city, says this has been one of their best turnouts yet, and she's thrilled to see families across the area enjoying the winter fun.
It's exciting to see people out again. It started off a bit slow with the snow, but definitely picked up in the afternoon. So it's great to see people out, looking at the sculptures, taking pictures, ice fishing, as you can see behind me. There's quite a few people out today, and I think to be expected, right? Because I think people are just looking for something to do. Yeah, this is probably the biggest we've seen in the last little while, given that we haven't been able to gather together.
It's no secret the pandemic has made it difficult for residents to get out of the house, so we spoke to some families about how much they've appreciated the chance to be involved in the outdoor festivities.
We love coming down here every year that we can. The snow sculptures are amazing as always, and yeah, definitely good to see people out and about.
I think the ice sculptures are really cool. Those people are very talented.
It's so nice to see all the beautiful sculptures. Like, some of them are so amazing.
What's your favorite part about that, the snow sculptures?
That they're big.
The snow sculptures were here, but I'm really glad it came out. There's some really neat ones there. It looks like they spent a lot of time doing it.
Like, I think I accidentally, one of my feet got stuck in the, like one of the, like a little hole. But then I got it out, and I was okay.
Meanwhile, the Fort William Historical Park had to cancel their outdoor activities and demonstrations on Sunday due to the heavy snowfall. But event organizers are looking forward to having locals back on the Family Day Monday from 11 in the morning to 5 in the evening. Join now with Kurt Black. Kurt, some exciting events being held here this weekend, as we just saw, and some exciting hockey action as well.
Yeah, that's right, Alex. If you didn't want to be outside, well, you could have gone to Fort William Gardens and watched the Thunderwolves as they enjoyed probably their best weekend of hockey all season long. We'll have all the highlights right after the break.